Welcome everybody to this Astranti video for the May 2019 Strategic Case Study exam on Denby Healthcare. And this is the industry analysis. So by the end of this video, you should have a good overview of the healthcare sector and some of the top issues and trends that are impacting on a company like Denby. But what's important to point out is that this is designed to be used alongside the industry analysis document, which as you can see contains a comprehensive overview of the industry in a lot more detail, whereas in this video I'm just going to be picking out some of the top issues that are likely to come up in the exam, that you're likely to need to be very familiar with in order to secure those top marks. So how can you best use this analysis in order to secure those top marks? Well, first and foremost, the case study exam is essentially a virtual business roleplay. So it's important that you understand the role that you need to adopt in the exam in order to help you produce a good answer which is pitched at the right level for your audience. So you can see that in the pre-scene we're told that you're a senior manager in the finance function at Denby. So what that means is that in order to succeed in your role, you're naturally going to need a good understanding of the company. But what you also need is a knowledge of the industry, the key trends and the issues that are impacting, in this case, on the healthcare sector as a whole, and then how that impacts on the company. So before we take a look at the top issues in the industry and the key trends and the influencing factors that are affecting Denby, let's briefly look at an introduction to the industry, and let's look at the wider healthcare industry as a whole. And the industry is one of the world's largest and fastest growing industries, and it forms a really vital part of the global economy. So it's arguably one of the most important sectors in the world, and in both developed and developing nations, there will be some element of government involvement in healthcare. And this can range quite drastically from country to country. So essentially, government involvement might just be a basic monitoring role. So monitoring communicable diseases like flu or interventions to prevent epidemics. Some countries might have more extensive involvement through delivering immunizations and vaccinations, screening for certain diseases, and also programs of health promotion. But it can be the case that in some countries, there is a publicly funded healthcare system. So a central government fund is set up, which essentially ensures that all citizens in that country can receive healthcare. And this is the case in countries like the Nordic countries of Sweden, Finland, Denmark, and the United Kingdom. So in the public healthcare system like the UK, the government has a large amount of control, and healthcare is provided from a central government fund, and the NHS provides healthcare for all UK citizens for free, funded through taxation. But it can also be the case in some countries that a government's role is ensuring that all citizens are covered through a financing agreement or a health insurance plan. So that's the case in countries like Germany, Belgium, France, and Canada. Now, on the other hand, private healthcare is healthcare provided outside of any publicly funded system. So in independent hospitals, in independent clinics, which are run independently of the public government provided healthcare service. And these facilities are normally run by a company, but in some instances they can be run by charities or non-for-profit organisations. And there are a number of reasons why an individual might choose to pursue getting treatment in a private facility over a publicly funded one. And it's things like the access to the treatment tends to be a lot quicker. There's a lot more choice. There's more opportunity to have a more personalised experience to choose your consultant or your specialist. There's the option to have treatments which might not be available on the National Health Service, maybe due to cost reasons, for example. And also the surroundings tend to be a lot more comfortable. So the rooms tend to be private rooms with ensuite facilities. There tends to be no restriction on visiting. The food tends to be of a lot greater quality. And people can perceive that as being beneficial to their recovery. And the way in which healthcare is funded varies drastically, again, from country to country, depending on the amount of government involvement, for example. But there are, in principle, four main ways that a healthcare system can be funded, and many countries actually use a mixture of these. So the first is through taxation. So essentially, this is the case in predominantly government-funded public healthcare systems. Most of the money that is put into healthcare within these countries comes from taxations. So the tax that individuals pay goes into a central government fund, which is then used to provide publicly funded healthcare services to the citizens of that country. Now, the other most common type of healthcare cover is from voluntary or private health insurance, or PHI. So essentially, this is where individuals or employers take out healthcare insurance policies from private organisations. And there's a range of different companies that provide private healthcare, but policyholders need to contribute on a regular basis, and the size of the amount that they contribute is determined by the level of risk that they're going to require healthcare. So essentially, the older you get, the higher your premiums get. If you're in a high-risk group for a certain disease, for example, then that might increase your premiums. And these contributions are collected by the private insurers, and then should private treatment be required, the private insurer will essentially cover the cost of that treatment or cover the cost of part of that treatment. Now, in some cases, PHI is mandatory, so it has to be paid. In some cases, PHI is taken out by individuals in higher income groups. So this is the case in countries like the UK, which does have a publicly funded healthcare system, but individuals in higher income groups with that level of disposable income might choose to take out an insurance policy so that they're able to access a better standard of medical treatment more quickly than they would through the publicly funded NHS. In some countries, private health insurance is used alongside social insurance schemes, so it covers the costs of publicly funded services that incur user charges. So that's the case in countries like France. And then in some instances, the PHI provides coverage for services that are excluded from government insurance schemes. So that can be the case of covering things like certain vaccinations or prescription charges, which is the case in countries like Canada. And in some cases, private health insurance simply provides an alternative. So for those individuals in high income groups who are permitted to opt out of receiving any government or statutory social insurance schemes, like in Germany, for example. And that again tends to be in those higher income groups. Now, some countries have social health insurance. So this is the case where employees and employers pay contributions to cover a defined package of services. So essentially, members have to contribute a proportion of their salary and their employer matches that contribution. And then the insurer is responsible for paying part or all of the healthcare costs that are incurred when an individual needs treatment. And these funds could be publicly run or they could be privately run. And as I said earlier, there's a range of different healthcare insurers, and you can see some of the insurers that are available in the United Kingdom. Now, the final way in which healthcare may be funded is through out-of-pocket payments. And essentially, this is where an individual pays for all or part of their medical care that's not covered by either publicly funded healthcare or by insurance, for example, out of their own pocket. So it comes out of their disposable income. And simply, patients are responsible for paying the cost of their care. And this can include things like the use of bedside entertainment systems, charges for vaccines or pharmaceuticals. But these charges are also incurred when an individual is looking to receive a treatment that's not covered by a national scheme. So for example, it might be by choosing to pay for an operation because they just simply don't want to wait for the publicly funded treatment. Or it could be the case that it's not deemed essential, so it's very highly elective treatment, like cosmetic surgery, for example. So that's the different ways in which healthcare can be funded. But if we look at Keyland, what we can see is that the country is very similar to the United Kingdom, in the sense that it's a developed nation. It's prosperous, and it also has a publicly funded healthcare service which covers all of its citizens. And so therefore it's reasonable to assume that it's fairly similar to the UK, which has the NHS. So we'll be comparing the private healthcare industry in Keeland quite heavily to the industry in the United Kingdom. And the industry in the UK is dominated by 5 companies, which made up 68% of the private sector healthcare revenue in 2017. And what's interesting to see about these competitors, which we will be discussing in a bit more detail later on, is the vast range of services they offer. So Spire Healthcare, for example, provide diagnostic, inpatient, day case and outpatient care, and they cover patients that are being funded through many different means, so insured, self-pay and National Health Service patients. What's also interesting is the fact that they've got a specialist service, so a specialist centre that's specifically treating oncology patients, so those patients that have been diagnosed with cancer. But they also provide a sports medicine service, which is called the Perform service, which focuses on providing high quality physiotherapy and rehab to professional sports players, sports coaches and sports teams. So you can see it's quite a diverse range of operations that some companies offer. And if we go down to look at Nuffield Health, what's interesting here is that it's a non-for-profit healthcare provider. So unlike the other companies in the top 5, which are all profit-seeking organisations, Nuffield Health is essentially a charity. And they operate 31 hospitals, but they also have quite a diversified offering. They also offer health, fitness and well-being gyms. So you can see that there is quite a range in terms of the services that companies operating within the industry offer. But on the whole, there are a range of quite fundamental services that many of the companies operating in the industry will provide. So there's the diagnostic services. So that's those services that are focused on diagnosing certain diseases, potentially through ranges of tests like allergy testing, gene, fertility testing, or it could be through imaging, so through x-rays, MRIs, scans, or ECGs and ultrasounds, for example. Many will provide medical services, so that services essentially aimed at treating a condition or treating a disease without using surgery. Whereas on the other hand, many will also provide surgical treatments, which are essentially performed via operations. So that's things like cosmetic surgery, general surgery, or orthopedics, for example. Now, as well as the surgical, medical, diagnostic services that you might think are fairly stereotypical of every healthcare company, many healthcare providers also provide some other complementary therapies, so to speak. So this is things like holistic care that are designed to support a patient's overall well-being. So that's focused on things like psychology, physiotherapy, psychotherapy, looking at the nutrition of different patients. And these can be available as independent services. So potentially you want to go specifically to get some tailored nutritional advice, some specific physiotherapy that is going to help you maybe perform better in certain sports that you play. Or it could be the case that this is provided after you've had your main bulk of treatment. So it could be rehabilitation after an operation, for example. And the services that many of the healthcare providers offer is incredibly diverse. We can see here from Ramsay Healthcare, there's a huge amount of different departments within the company that offer a range of different services. And as I touched upon earlier, Spire have a designated, dedicated sports therapy division, which deals specifically with high-performing sports individuals and sports teams to offer rehab and hydrotherapy, acupuncture, nutrition, pediatric sports injuries, and sports science performance and testing. And what that really highlights is that there's such a diverse range of services that a company can offer. So there are a number of different revenue streams that a company can look to capitalise on, diverse range of treatments that they can look to offer, and a huge number of opportunities. Now, obviously the treatments that hospitals provide are the most important thing to patients. That is essentially what they are looking for when they choose a private healthcare provider. But on the other hand, something else that's really, really important, specifically to patients in terms of their recovery, is the facilities that the hospital provides. And we won't go into this in too much detail, but essentially private hospitals tend to have a much more comfortable environment for patients to recover in. So we've talked about the fact they've got private rooms, for example, unrestricted visiting hours. Many of them will have much higher quality food, for example. So all of that goes into creating a much better patient experience, which is important when patients are choosing to have treatment privately. So what we can ascertain from all of that in relation to Denby is that the company tends to be fairly typical in respect to the way that they generate revenue. So we've seen that the company has 4 key customer groups. So it's got the overseas patients, it's got the KHS patients that are referred. So that is essentially generating funding through taxation because it's the KHS which is paying for the treatment at Denby's hospitals. There's the self-pay patients, but there's also those that are covered by health insurance. And we talked about the fact that Keyland is very comparable to the UK, which has the NHS, so we can assume that the government in Keyland has both a large interest in and an influence on healthcare, the cost associated with it, and the way in which the industry is regulated. So we know it's got KHS quality inspectors which carry out reviews, for example, which is very similar to the CQC in the UK. Now, we're also told in the pre-scene that Denby's hospitals are equipped to offer a full range of services. So that goes from diagnostic all the way through to post-operative care. But there's no specific mention of any particular areas that the company focuses on. So we saw Spire Healthcare has a specialist cancer centre, but we don't know whether Denby do offer anything that's very specific to one type of disease or one type of treatment, which is a potential area that the company could potentially look to capitalise on. They could look at offering very specific, specialised niche service. And again, on that note, we can see in the pre-scene that the Keyland Daily News article highlights that a Keyland professional footballer had to travel abroad to receive specialist care that was not available in Keyland. So what that's showing us is that there is scope for a company like Denby to capitalise on an evident gap in the market in Keyland, which is the provision of a sports-based medicine service, which is similar to the Perform branch of the Spire company that we talked about earlier. And another thing which is going to come up again later on when we talk about customer trends, but it's important to mention here, is that mental health is a huge, growing global issue. There are a huge number of patients in the world that are suffering from one or more mental health conditions. And we can see from the article in the pre-scene, the Healthy Living article, that GPs are more and more frequently choosing to refer patients for counselling or holistic or psychological therapies over prescribing medication. And we don't know necessarily whether or not Denby do or don't offer mental health services, but this is one area that the company could look to capitalise on in the future. So that's a brief introduction to the industry, and what I hope you managed to gain from that section is just how diverse the sector is. There's a huge number of companies operating a huge number of different services. There's plenty of opportunities within the sector, but it is heavily regulated. There's a huge amount of government involvement. Naturally, when you think about the fact it's dealing with people's health, people's lives are on the line in some instances. So it's going to have a huge amount of regulation, government oversight. And what's also interesting is just how complex the funding side of thing is. In many cases, there are multiple different ways that patients can pay for it. Sometimes they're using more than one to pay for one sort of treatment. So it's quite a complex landscape with lots of different stakeholders, lots of different factors that are influencing on it. So I hope you enjoyed that sample of the SCS industry analysis video, but before we end, there are a couple of other products that we at Astranti provide that I'd like to draw your attention to, which we believe will be hugely beneficial for you in your preparation for the case study exam and give you the best chance of passing. So we offer 2 study texts which provide key pieces of advice geared towards passing the case study. So we've got study text 1, which covers your role, how to analyse the pre-scene, exam preparation, writing approach and time management advice, as well as study text 2, which summarises the most commonly examined topics from the OT exams. And we've also got a full set of course videos which show you what it takes to pass the exam. So again, we talk about planning and writing advice and how the case study is marked. Now we've got a full range of pre-scene analysis materials, and these pick out key information from the pre-scene, apply the key theories and models to the pre-scene scenario, and highlight the top 10 issues likely to come up in your case study. Now, we've seen it's really important you can show you have fully understood the pre-scene industry and apply all of that knowledge in the exam. And so the industry document and video essentially provide you with the tools to do this. Now, we also provide mock exams which are tailored to the pre-scene based on the topics most likely to appear in your exam, and we provide additional marking and feedback which will allow you to see your strengths and your weaknesses and get advice from a CIMA tutor on how you can improve. Now, our masterclasses are a live online study environment and they're fully interactive, and this allows you to ask questions and clarify your understanding. And because we believe that our case study course contains everything you need to pass your exam, we have a pass guarantee. So essentially, if you get to results day and you haven't passed, but you've purchased and completed our full course, then we will enrol you on the next course free of charge as part of our pass guarantee. So you can see we offer a huge range of materials, all designed to maximise your chances of passing the exam. So head over to our website and check out what we have to offer. Thank you very much. Bye bye.